Let's go back to our top story now and the offer of a COVID booster jab to every adult in England by the end of the month. Let's talk to Patricia Marquis, the Royal College of Nursing's Director for England. And a good morning to you.
Good morning.
Was the Prime Minister right, in your view, to extend the booster programme in this way?
Yeah, absolutely. It's clearly necessary, given that we now know that two vaccinations are not adequate to protect as fully as we can. So absolutely, it's the right announcement, but it does come at a time when we all I think are aware that the NHS is already under immense pressure. So whilst we need to do what we can to protect it from the worst impacts of COVID, it also will bring more pressure for them to deliver at such a scale and pace.
So therefore, do you think the targets are achievable? Because it's never been done before.
It's never been done before. What I do know is that all NHS staff, be it managers or frontline staff, will pull out all of the stops to do what they can. And I'm sure that more of the public or the volunteers, etc., will come forward. So I think people will give it a really good go, but it will inevitably come at a price, both for some individuals working harder and longer than they are already doing, which is already, more than they should in many cases. And it will impact on other health services, which will just have to step back for a short while whilst this gets achieved.
OK, you raised 2 points there. Let's take them in turn. First of all, for your members, the nurses, tell us a bit about the kinds of pressures they're facing now, and in many ways it might be useful to know how they compare to this time last year.
So this time last year, we were obviously going into wave 2 or 3, depending on how you define the waves. And things were really ramping up, and it was a lot of pressure of people with COVID on the services across health and social care. The difference this year is that the pressure is partly from COVID and the impact of COVID, social distancing measures, PPE, the impact all of that has had on social care, which means that the health services not got places to discharge people to. So there's lots of impacts still of COVID, but it's a different sort of pressure. The big pressure now is the normal health service pressure of winter, plus all of the catch up from the last 18 months. And now with a fear that the pressure of COVID is going to rise as well. So it is very different to last year, but it is also a continuation of what for most health and social care staff has been the situation now since March, when all of this started.
And then to pick up on your other point about the impact on patients, patients who aren't suffering from COVID, what will it mean for your members when it comes to other services and those patients who are having their routine, appointments cancelled?
Very sadly, it is likely to mean that some of those routine appointments may have to be postponed and delayed. It may mean that some of those GP appointments, some of those hospital, both outpatients and surgery, etc., does need to be delayed to enable the service to have enough capacity to do what it needs to do to protect it from being overwhelmed by people with COVID. So it is going to no doubt have an impact on some patients, and that will break the hearts of most health and social care staff who will absolutely be wanting to do everything, but we just realistically can't.
Patricia Marquis from the Royal College of Nursing.